Welcome back to OpenLine. We were talking about mental illness in the homeless community. We have with us Dr. Sheryl Fleisch from Vanderbilt University with a street psychiatry program, Nathan Sharkey, News Channel 5 photographer, who put together a film on this that we showed a little earlier, and that is online, right? You can see it over and over. Yeah. Several calls. Let's go to Denise. Hello, Denise.
Hello.
Hi, go right ahead.
I was calling, I don't know how, a friend of mine told me to turn on this station and that I could ask some questions about maybe somebody could help me through this.
Okay.
Well, I'm older now. I'm 60 years old now, but I've been trying ever since I was a young girl, around about 12, when I realized I couldn't read and spell. I can write pretty good, but I can't read and spell, and I've always tried to get help with it, and everybody tell me I should, everywhere I go, they tell me I need to see a doctor or something. Like, I know I'm not retarded or anything. I just don't know why I can't comprehend. Is that a problem? And it's holding me back because I can't fill out applications and get jobs. But I could when my sister was living. She's deceased now, and she used to fill out applications, go with me, help me get jobs. But since she's been gone, I've been sort of really lost because I can't do nothing without her help.
Do you have a place? Do you have a place to live?
Else. I even have a husband, and he don't even know that I'm really illiterate. They say I'm illiterate or something. Oh,
wow. Okay, let's talk about that. There's so many causes to people struggling. You know, what do you recommend for Denise?
Yeah, I think there can be a lot of challenges. I think for folks who are struggling, both with mental illness and with probably learning disorders or illiteracy, I think there are a couple of different things. One is if you don't already have insurance, I think one of the things will be to try to figure out a way to obtain insurance and to obtain healthcare benefits. If you're having challenges filling out some of the forms, one of the things that you can do is go to Metro Social Services. It's at 800 2nd Avenue South. And that would be one of the best ways to start, and they can actually assist you to fill out a lot of the applications. One of the other places where you can go for assistance if you're struggling with mental illness or a learning disorder, you have to also have a mental illness, would be to go to Park Center. It's a nonprofit that our team partners with. It's at 948 Woodland Avenue it's Woodland Street, I'm sorry, in East Nashville. And they also have employment services, and they can also assist with different applications and can assist in determining what other resources might be beneficial. So I would say Metro Social Services would probably be the first place, and then perhaps Park Center for some other resources. Lastly, I would say probably Mental Health Cooperative would be another place to go. They're on Metro Center on Cumberland Bend, and they can also assist.
Okay, and you've been in other cities. You've been in Pittsburgh and other cities. How do you think the safety net here compares? I mean, where do you think we are as far as the services that are available in our city?
Yeah, so I've lived in Pittsburgh, and I've lived in Chapel Hill, North Carolina, and I think we fall somewhere in between. I've also had the opportunity to do various site visits in other cities, and I've seen other programming. One of the coolest places I went to was actually in Jacksonville, Florida, where they have something called the Sulzbacher Center, which is where all of the homeless services are actually in one spot. So in like one large campus. And I think that would almost be like the dream. That's where we would want to go to. I think when you compare our safety net services to there, we have a ways to go. I think if you compare our safety net services to a place where essentially other states where Medicaid hasn't expanded, where there's also not really affordable housing. When I lived in Chapel Hill, it was over 2 years to wait even to consider housing. So the fact that we actually have accessible housing vouchers, at least for some people, is a step in the right direction.
Do you think, and then I'm going to get to calls, I promise, do you think some cities are reluctant to start services because they worry it would attract more homeless? And what do we do about that?
So I hesitate to say this a little bit, but my parents live in Sarasota, Florida, and so I follow a lot of the news there. But I think one of the concerns in Sarasota is exactly that there would be potentially an influx of services if they were to build like shelters, for instance. And I think here as well, if we build the services, maybe people will come. I would argue, as would most people who have expertise in homelessness, that if one builds the services, people will utilize the services, and homelessness will actually decrease. And I think all of the data and research backs that up.
Let's go to Reverend Fuzz. Hello, Reverend Fuzz.
Hey, man, listen, I've dealt with this a long time. It's one of the most wretching things. I've had a family who's homeless and bad memory ill. The only way he could get help was that he came and said, I'm going to kill a policeman. But they only put him in the hospital for 7 days, and he was back out with his family and nowhere to go. I want to ask, what in the legislature, what's hindering, and what do people like us, citizens, what we need to do to talk to legislators and lawmakers to get funding? I've seen that one legislator passed a bill that if you're in jail for 2 days, you get free health care. All you got to do is go to jail for 2 days, and that just passed the legislature, and you get free health care. So where do we go? Give us some ideas of what can we do. I've know so many people who are living outdoors and who are mentally ill.
Right. All right, thank you, Reverend Fuzz. What do you think?
So I think that was a great question. I think one of the major barriers that you're seeing is actually what was mentioned at the beginning of the program. When deinstitutionalization occurred back in the 1950s, a lot of the state-funded hospitals decreased, and people who were really mentally ill, the plan was for them to actually almost be like freed to go out into the community and have community-based services. The problem is that a lot of the community-based services aren't as available or aren't as available for the length of time that they were originally planned for, or to add to all of this, they aren't as there are too many people now that require those services. So the people that were originally meant for those services aren't able to utilize them the way that they once were. So now we're in a situation where there are only, for instance, in Tennessee, there are actually only 4 mental health state hospitals. So what you said is incredibly true, where somebody may be discharged to our state hospital and then truly may be released prior to when you might think that they should be released, which really causes a problem. In terms of what to do about it, that is a really big challenge, because no matter how many notes that we write to legislature, and no matter how many things we do, we would need to locate the state funding and almost re-institutionalize people. Very quickly, I'll mention that even when I lived in Pittsburgh, as I was doing my residency, one of the state hospitals actually closed as I was doing my residency. So then our hospital, actually, one of our floors actually became almost like a state hospital unit. And so it is extremely challenging. It's not just here in Tennessee, it is in many of the cities in the United States. I didn't really satisfy the answer to your question, but I will say that it is an incredibly challenging situation.
Well, I was just going to follow up with that too, with even today we were talking about the president possibly setting out a national emergency on the opioid case. And I think it opens up the debate on addiction and substance abuse with mental health. And I think if we start seeing more of this as a crisis, that potentially that our legislators will kind of consider all the factors and maybe, you know, move forward with some sort of financial means.
That's a good point. I mean, there's a lot of focus on the opioid epidemic, on the addiction surrounding opioids. If you were to somehow treat that, is addiction a mental illness? What is that? Is that controversial? Is that what is addiction a mental illness? Would be, I guess, a question that I would have. What do you think?
I believe so. I think we've shown that addiction is a genetic disorder. Addiction in the Diagnostic and Statistical Manual is something that we diagnose as a mental illness, and so I believe that addiction is a mental illness. It's often comorbid with what we consider primary mood disorders, psychotic disorders, anxiety disorders, depressive disorders. So there's a large congruency between the two. And about 2/3 of individuals who struggle with homelessness will have a substance use disorder, and about 80% will have a substance use disorder over their lifetime. So it's a really significant issue.
All right, that's a huge issue. All right, we're going to take a break, and then I'm going to take the rest of the calls. So hold on. I'll take your calls, take a break, be back right after this.